Welcome to G Fun Facts Online. Today, we're diving deep into the world of dentistry, where a revolution is quietly taking place. The pursuit of a perfect smile is no longer a lifelong quest filled with conspicuous metal and lengthy procedures. We're now entering an era where losing a tooth doesn't mean months of waiting for a replacement. At the forefront of this change are same-day permanent zirconia dental implants, a groundbreaking technology that promises a strong, beautiful, and permanent tooth in just a single day. So let's unpack how science and medicine are making this possible. For decades, if you needed a dental implant, the answer was almost always titanium. It's strong, durable, and has a well-documented ability to fuse with bone, a process called osseointegration. It's been the gold standard for a reason. But now, a formidable challenger has entered the ring: zirconia. Zirconia, or more formally, zirconium dioxide, is a type of high-performance ceramic. The first thing you'll notice about it is its color. It's white. Not just off-white, but a natural, tooth-like white. This is a massive aesthetic advantage over the grayish hue of titanium. With titanium implants, there's sometimes a risk, especially if you have thin gums, of a dark line appearing at the gum line, a subtle but definite giveaway that you've had dental work done. Zirconia eliminates this problem entirely. From day one, the implant itself looks like a part of a tooth, making it a perfect choice for highly visible areas like your front teeth. But the benefits go far beyond just looking good. Zirconia is a metal-free material. This is a game changer for a growing number of people. If you have a known metal allergy or sensitivity, titanium might not be an option. Zirconia provides a completely hypoallergenic alternative. Many patients also simply prefer a more holistic or metal-free approach to their healthcare, and zirconia fits that philosophy perfectly. Its biocompatibility is excellent, meaning the human body accepts it readily, and it promotes healthy gum tissue growth around the implant. Some fascinating studies even suggest that zirconia may accumulate less plaque than titanium. The smoother surface of the ceramic appears less hospitable to bacteria, which could lead to better long-term gum health and a lower risk of implant-related infections. So you have a material that's strong, tooth-colored, and incredibly body-friendly. Now let's pair that with the second part of this revolution, the same-day procedure. Traditionally, getting a dental implant was a marathon, not a sprint. The process could easily stretch over several months. First, the dentist would surgically place the titanium implant post into your jawbone. Then, you'd wait. This healing period, typically lasting 3 to 6 months, was crucial for osseointegration to occur. That's the process where the bone grows around and fuses with the implant, anchoring it firmly in place. Only after this long wait could the permanent crown, the visible part of the tooth, be attached. During those months, you might have to wear a temporary and often uncomfortable prosthesis, like a removable flipper. The concept of same-day implants, also known as immediate loading, completely upends this timeline. Thanks to incredible advancements in dental technology, particularly 3D imaging like cone beam CT scanning and computer-guided surgery, the entire process has been compressed. These technologies allow the dentist to create an exceptionally precise digital map of your jaw. They can plan the exact position, angle, and depth of the implant before the surgery even begins. This meticulous planning means that on the day of the procedure, a permanent, or at least a very high-quality, durable temporary restoration can be placed on the implant almost immediately after it's been surgically inserted. A patient can literally walk into the dental office with a gap in their smile and leave that very same day with a functional and aesthetically pleasing replacement tooth. In some protocols, the final permanent zirconia crown is placed within 24 hours of the surgery. This isn't just about convenience. It's about restoring quality of life instantly. When you combine the superior material of zirconia with the speed of an immediate loading technique, you get a truly powerful solution. Zirconia's inherent properties make it almost purpose-built for the demands of a same-day protocol. Its excellent biocompatibility and the way it interacts positively with soft gum tissue can lead to a more predictable and aesthetically pleasing healing process right from the start. Crucially, modern dental zirconia is incredibly strong. While early ceramics in dentistry had a reputation for being brittle, the zirconia used today is a different beast altogether. It's engineered to be robust enough to withstand the immediate forces of chewing, which is a critical factor for the success of any immediate loading procedure. The implant has to be stable from the moment it's placed, and zirconia delivers that stability. So let's put these two materials head to head. How does zirconia really stack up against the time-tested champion, titanium? In aesthetics, it's a clear win for zirconia. Its white, opaque color is simply a better match for natural teeth, eliminating any risk of a metal color showing through the gums. In terms of biocompatibility, both are excellent. The body accepts them well. However, for anyone with metal allergies, sensitivities, or a preference for holistic materials, zirconia's metal-free composition makes it the undisputed choice. When it comes to strength and durability, titanium has an incredible long-term track record, backed by decades of clinical data. It is exceptionally strong. But zirconia is no slouch. Modern zirconia is a very strong ceramic, fully capable of withstanding the immense chewing forces in the mouth. For osseointegration, that critical fusion with bone, both materials perform effectively. Interestingly, some in vivo studies have suggested that the bone density around zirconia implants may even be higher than around titanium implants over time, indicating a very robust integration with the jaw. As a ceramic, zirconia is also completely resistant to corrosion. In the moist, acidic environment of the mouth, this is a notable advantage, as metals can, over very long periods, be prone to corrosion. Finally, there's gum health. As mentioned earlier, the smooth surface of zirconia may be less prone to plaque accumulation compared to titanium. This small difference could have a big impact over the life of the implant, contributing to healthier gums and reducing the risk of peri-implantitis, an inflammatory condition similar to gum disease. So what does this journey look like for a patient? It's surprisingly streamlined. It all starts with a consultation and detailed planning phase. This is where the magic of technology comes in. The dentist uses a 3D CT scanner to get a perfect, high-resolution image of your jawbone. This allows them to assess bone density and volume with incredible precision. Using this data, they create a computer-guided surgical plan, essentially performing the surgery digitally before you ever sit in the chair. Next is the surgical appointment. On the day of the procedure, if there's a failing tooth, it's extracted. Then, guided by the pre-made digital plan, the zirconia implant is carefully and precisely placed into the jawbone. Because the planning is so detailed, the surgery itself is often minimally invasive, leading to less discomfort and faster healing. And then comes the final transformative step, the immediate restoration. Within hours of the implant being placed, or sometimes the very next day, a custom fabricated crown is attached to the implant post. This might be a highly durable temporary crown designed to last through the final healing phase, or in many cases, it's the final permanent zirconia crown. Either way, you leave the office with a complete, functional smile. No waiting, no temporary partial dentures. Of course, a key question for any medical procedure is, does it work, and for how long? The evidence is very encouraging. Titanium implants have a fantastic long-term success rate, often cited as up to 95%. Zirconia is showing similarly promising results. While it's a newer material, some studies show comparable success and survival rates to titanium. One notable 8-year follow-up study on one-piece zirconia implants reported a 100% survival rate and an overall success rate of nearly 90%. For same-day or immediate load implants specifically, multiple studies have reported 10-year survival rates between 90% and 95%, which is right on par with traditionally loaded implants that require months of healing. The key takeaway is that the success of these advanced procedures is highly dependent on two factors: proper patient selection and the skill and experience of the clinician. So, who is a good candidate for same-day zirconia implants? The ideal patient is generally in good overall health and, critically, has good oral health. This means healthy gums and, most importantly, sufficient jawbone density and volume to securely support the implant from day one. Non-smokers tend to have more successful outcomes, as smoking can impair healing. A thorough examination, including those 3D scans, by an experienced implant dentist is the only way to know for sure if this procedure is the right option for you. Now, let's talk about the investment. This advanced technology comes at a cost. Same-day zirconia implants are typically more expensive than traditional multi-stage titanium implants. This is due to the advanced ceramic material, the sophisticated 3D imaging and planning technology, and the expertise required to perform the procedure. A single implant, including the surgery, the implant itself, the connecting abutment, and the final crown, can range from approximately $3,000 to $6,000. For a full arch restoration, where you're replacing all the teeth on the top or bottom jaw, the cost can be $30,000 or more. While this is a significant investment, many patients feel the benefits, the immediate results, the superior aesthetics, the metal-free biocompatibility, and the convenience of a single-day procedure fully justify the cost. It's important to have a balanced perspective. While the benefits are numerous, there are considerations. Zirconia is a ceramic, and while it's very strong, it is inherently more brittle than a metal like titanium. There is a small risk of fracture, especially if the implant is placed in a less than optimal position or subjected to extreme, unnatural forces. This brings us to the most critical point of all. The procedure is highly technique sensitive. The success of a same-day zirconia implant rests heavily on the shoulders of the dental professional. It is absolutely crucial to choose a dentist who has extensive experience and specialized training in both implantology and, specifically, with immediate loading protocols and ceramic implants. In conclusion, same-day permanent zirconia dental implants are more than just a new product or technique. They represent a fundamental shift in the philosophy of dental care. The focus is moving towards solutions that are not only functional, but also more immediate, more aesthetic, and more harmonious with the human body. As the technology continues to be refined and more long-term data becomes available, this innovative approach is set to become an increasingly popular choice for patients who want the absolute best in tooth replacement. The future of a perfect smile isn't just about restoring what was lost. It's about recreating nature's perfection in form, feel, and function, and doing it faster than ever before. The future of dentistry is bright, and it's also brilliantly white.